Hello everyone, welcome to this video on vertebrae in radiology. In this video, we will be discussing some characteristic X-ray vertebral appearances that have been described in radiology. Okay, so we start with vertebra plana. Vertebra plana refers to complete loss of vertebral height as shown in this X-ray, and the mnemonic that we can use to remember the differentials is I melt, that is infection, metastasis, eosinophilic granuloma, which is a continuum of Langerhans cell histiocytosis, lymphoma and trauma. Okay, so vertebra plana, that is diffuse loss of vertebral height, and the mnemonic is I melt. Okay, ivory vertebra refers to this homogeneous sclerosis of a vertebral body. Homogeneous sclerosis, that the vertebra appears much whiter as compared to the other vertebra on this X-ray. And the mnemonic that we can actually use for differentials is LMP, that is lymphoma, metastasis and Paget's disease. Okay, ivory vertebra in LMP. Okay, so picture frame vertebra refers to this sclerosis of all the four edges of the vertebra. Okay, and this forms a picture frame vertebra, and the diagnosis here is Paget's disease. So P for picture frame, P for Paget's disease, right? Moving on to the rugger jersey spine, here we have sclerosis of only the superior and inferior end plates of the vertebral body, but the point to note here is it is an irregular, it is an ill-defined, right, ill-defined sclerosis of the superior and inferior end plates of the vertebra, and the diagnosis here is renal osteodystrophy, that is secondary hyperparathyroidism. So R for renal osteodystrophy, R for rugger jersey spine, right? So the other differential is of the rugger jersey spine is sandwich vertebra. Sandwich vertebra is again the sclerosis of superior and inferior end plates, but this time it is well defined. So well defined sclerosis of the superior and inferior end plates of the vertebra, and the diagnosis here is osteopetrosis, which is a skeletal dysplasia, a sclerosing type of skeletal dysplasia. All right. So the next vertebra is a bullet shaped vertebra. The bullet shaped vertebra refers to this posterior scalloping of the vertebral body and anterior rounding or anterior beaking of the vertebral body. This forms a bullet shaped vertebra, and it is seen in achondroplasia, which is another skeletal dysplasia, and it is actually a cause of rhizomelic dwarfism, that is proximal bone dwarfism. Achondroplasia having bullet shaped vertebra. Okay. H-shaped vertebra are seen in sickle cell anemia, and here there is well defined central depression of the vertebral end plates, and this is actually because of the bone infarcts that are seen in sickle cell anemia. Okay, so H-shaped vertebra in sickle cell anemia. Moving on to the fish mouth vertebra, also known as the codfish vertebra. This is actually due to the biconcave appearance of the vertebral bodies. Biconcave appearance of the vertebral bodies, and the diagnosis is osteoporosis. Right. So this is actually the table that we need to remember. So vertebra plana, that is complete loss of the vertebral height. The differential diagnosis is infection, metastasis, eosinophilic granuloma, lymphoma and trauma, that is I melt. Right. Ivory vertebra seen in LMP, that is lymphoma, metastasis and Paget's disease. Picture frame vertebra seen in Paget's disease. Rugger jersey spine in renal osteodystrophy, that is R for renal osteodystrophy, R for rugger jersey spine, P for picture frame vertebra and P for Paget's disease. Sandwich vertebra seen in osteopetrosis, bullet shaped vertebra seen in achondroplasia, and the H-shaped vertebra because of the bone infarct seen in sickle cell anemia, and the fish mouth vertebra seen in osteoporosis. All right. So these are the various vertebral appearances that we have discussed in this video. Thank you for watching. I hope the vertebral appearances are now clear to you. There are a couple of things I want you to do now. I want you to subscribe to our YouTube channel for more such videos, and please send us your suggestions or the topics that you want us to discuss in the comment section. Okay, and don't worry, we have your back. Okay, thank you.